Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
For those managing diabetes, understanding the critical link between the condition and tooth loss is essential. Oral health is a vital component of overall wellness, yet the connection between diabetes and dental complications is often underestimated. It has been observed that diabetics are more susceptible to tooth loss, primarily due to an increased risk of gum disease and tooth decay. This highlights the need for heightened awareness and proactive dental care among diabetics. By focusing on oral health, individuals can significantly reduce their risk, enhance their quality of life, and achieve better diabetes management. Together, we will unravel why this knowledge is crucial and explore actionable steps to protect both oral and overall health in the fight against diabetes. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and today we're addressing an important but often overlooked aspect of diabetes management, the connection between diabetes and tooth loss. To guide us through this vital discussion, we have with us the esteemed Dr. Rajiv K. Chugh. Dr. Rajiv Chugh is a highly esteemed endodontist and restorative dental surgeon with an illustrious career spanning 39 years. He has been in practice since 1984, providing expert dental care and earning a reputation for his professionalism and dedication to patient care. His academic journey has included extensive training and professional development, which have solidified his status as a distinguished leader in his field. Dr. Chugh has also been the national president of the Indian Dental Association for the term 2023-24 and is a visiting professor at the Sibar Institute of Dental Sciences. His contributions extend beyond clinical practice to include significant roles in dental education and organizational leadership. He is also the founder of Dr. Chugh's Dental Center, where he continues to innovate in the field of implant and aesthetic dentistry. Sir's commitment to advancing dental science is evident through his participation in numerous professional programs and his active involvement in the dental community. His expertise and dedication have not only benefited his patients, but have also contributed to the broader dental profession through education and leadership. Dr. Rajiv Chugh, THIP Media welcomes you, sir.
My pleasure. Thank you for this invitation. I'm really obliged.
No, the pleasure is all mine, sir, and thank you so much for joining us today. Okay, sir, we all recognize that diabetes can be a very challenging condition to manage. But people might not fully understand the serious implications it can particularly have on their oral health, especially when it comes to tooth loss. So, to address this important issue, I'd like to start our discussion with a very fundamental question that is it true that diabetics are at a higher risk of developing dental problems?
See, it's a well documented and well accepted that diabetes does affect the oral hygiene of a person.
Right.
And of course, what you mentioned, the tooth loss is one of the implications of this diabetes. But there can be many more issues, not only the tooth loss, which can be related today to diabetes.
Right.
And the thing is that most of the people do not understand that the diabetes can be that bad for a human being.
Right.
And it is today well documented that diabetes affects not only the oral hygiene. In fact, the oral hygiene also affects diabetes. That's another
Right.
implication. So
Okay.
it's very important to keep the diabetes under control.
Okay.
Our general health as well as the oral health.
Right. So what specific oral conditions, are diabetics more susceptible to? And how do these conditions contribute to tooth loss?
The most important thing one must understand is that the diabetes affects the tissues of the body.
Right.
And these tissues then eventually cause these complications. The most common implication of diabetes or whatever other side effects are of diabetes, the most important one is the gum disease,
Okay.
what we call as periodontitis.
Right.
And the gum disease leads to gum inflammation, and it leads to redness, swollen gums, and bleeding. This is the first sign that diabetes is affecting the gums.
Right.
And as the disease progresses, this condition can lead to tooth loss because it leads to the loss of infection, a loss of bone around the teeth. This gum inflammation can be damaging, and that's when the seriousness of the disease is that you can end up with losing these teeth because of the diabetes, uncontrolled diabetes.
Okay. Right. And like you just mentioned that keeping blood sugar control, the blood sugar levels in control could not only, help managing our general health, but also our oral health. So I'm just going to reinforce that part by simply asking that can effective management of blood sugar levels in diabetics reduce the risk of tooth loss? And if so, how?
See, the once your blood sugar is in control, then
Right.
the side effect of these diabetes, which results in the inflammation and bone loss, can be contained, and the loss of tooth structure or loss of tooth can be avoided.
Right.
Also, one must understand that diabetes also not only affects the gum, it also affects the tooth, causing tooth decay,
Right.
because it is very well known that high blood sugar creates an acidic environment in your mouth that can
Right.
also cause cavities. So if
Right.
you control diabetes, you also control the tooth decay. And the
Right.
third side effect of diabetes is dry mouth, or is what
Okay.
we call a xerostomia.
Right.
Because of diabetic medications, it affects the salivary gland function also, and
Okay.
also creates the mouth also becomes dry. There's a Because of which again the incidence of cavities is very high. Dry mouth is difficult to see that the saliva normally maintains the hygiene in the mouth, which we don't
Right.
realize. But when the dry mouth is there, it will cause more cavities also.
Right.
So if you have your blood sugar well under control, one, the gum diseases will not be that extensive.
Prevalent.
Second thing is that when not only these limitations or controlling the diabetes is important, it's also very important to go back to your dentist regularly, to go and get your cleaning and checkup done regularly basis, because only controlling diabetes is not going to help, because some
Right.
bit of inflammation is also there because of the food deposits which we tend to leave, and then your regular checkup, oral prophylaxis, and once a year your root planing or gum curettage is required. So to reinforce the fact that the visit to a dentist is important, especially
Right.
more important to people who are affected by diabetes.
Okay. Right. And like you just mentioned that, a regular checkup by a dentist is an absolute essentiality for a diabetic to follow. Right. So the ones who have undergone an extraction procedure, or let's say a regular scaling or root planing, do the blood sugar levels, which would be high, in the ones who are diagnosed with diabetes, affect the healing process of oral tissues after the performing or the performance of these dental procedures?
See, it is well known that anybody who suffers with diabetes have a slow healing process.
Right.
So any healing process in the body. So
Okay.
is true for the oral cavity as well. So if you undergo extraction, the healing would definitely be low,
Okay.
poor. In that situation, if your blood sugar is uncontrolled, it can complicate the situation, and
Right.
healing can be delayed a lot. So you should keep your blood sugar under control at that time. And
Okay.
otherwise, also, the healing is generally affected. So even after you go through any other procedure, like going through your cleaning and gum curettage or root planing, then also the healing is affected. So generally, since it is affected, control your blood sugar. That will definitely improve all the healing ability of your mouth.
Okay. So before any dental treatment, should a diabetic person proactively tell the dentist about his blood sugar condition?
Yes, any diabetic person has to share this information with the doctor. That's
Right.
very important because since the healing ability is poor, and we looking at the condition, we at times do advocate that the patient should be on antibiotic cover before they start
Right.
a procedure, which could delay the healing. So,
Okay.
sharing this information is very important with your dentist. There are some procedures which will not be advocated to people who have very high diabetes, high blood
Right.
sugar levels. So, in that case, we advise them to first control their blood sugar before they undergo the procedure. Suppose somebody who wants to have an implant, and then
Right.
in case that patient has very high HbA1c, which tells you the sugar level control in last 3 months. If the
Okay.
figure is very high, we normally would not do an implant in that patient.
Okay.
And we would like them to first control their blood sugar, get into a habit of keeping it controlled, and then only we will advocate that they should undergo procedures like that.
Okay. And like you've mentioned, that sharing the information about your blood sugar levels is a mandate when you visit your dentist. So, are there any preventive measures that diabetics, should take into account in order to minimize their risk of tooth loss?
See, the general hygiene care, oral hygiene
Mhm.
care is important for everybody. So is it for diabetes. They need to take more care. That would mean every 6 months visit is sort of mandatory for them.
Okay.
And once a year, at least once a year, they should get their gum curettage or root planning done. That's very, very
Okay.
important for them. If the
Okay.
doctor feels that they probably need it more frequent, maybe instead of 2 visits a year, they would like to do 3 visits a year. That is up to the dentist and on the patient. We
Right.
also advocate that these people brush their teeth at least twice a day, and at least once a day should be either flossing or using a water floss to maintain a good oral hygiene.
Okay.
Because we have seen that patients who do not maintain a good oral hygiene only, especially diabetic people, are more prone to periodontal diseases, gum diseases.
Okay. Right. And so, are there any specific dental care routines or products that are recommended for diabetics to, help maintain their oral health? Do you recommend any products?
See, I would recommend two things, basic things, the toothbrush and the dental floss. They're the most
Okay.
important things to be used.
Right.
And besides that, they maintaining a good hygiene and controlling their blood sugar. Their diet is very important. Their activities should also be, I'm sure the diabetologist who they're consulting would also advocate the same, that they
Right.
should control their diet. And otherwise, uh, I would not like to supplement anything else as of
Okay.
now,
Okay.
besides controlling their diet over the hygiene barriers.
Okay. Right. And how can technology help diabetics in maintaining their oral health?
See, technology-wise, as of now, uh, there are so many different gadgets available in the market for any diabetic to monitor their blood sugar levels.
Right.
So their diabetologist is the best person to do that. We normally would leave that to the diabetologist to do. But
Right.
once the diabetes is under control, they are entitled to any dental treatment, and they should not only for that particular treatment, they should bring it down, because subsequently also we have seen that suppose somebody gets an implant and doesn't maintain
A good oral
a
hygiene.
blood
Yeah.
sugar high, and poor hygiene is there,
Yeah.
or the blood sugar is uncontrolled, we have seen implants failing in those people. So maintaining blood sugar not only for once to get an implant or
Right.
any other procedure is important. It's important to keep maintaining it for the rest of your life.
Right. Right. And I'm just going to summarize this session, sir. That what are the implications of tooth loss on the overall health and quality of life for the ones who are diagnosed with diabetes?
See, it's an old saying which says loss of one tooth leads to the loss of the rest of them.
Yes.
Well, I
Yes.
would say that still holds good, not for that, that not only because of diabetes, generally also. If you lose one tooth, it disturbs the whole alignment of teeth. That can affect.
Right. Right.
Okay. In diabetes, people, the thing is that it's not going to happen that only one tooth gets affected because of diabetes. There
Right.
would be generally the oral hygiene would be poor, or generally the gum disease would be there. In those people, if they lose one tooth, then there's always a possibility that they might lose other teeth also if it is
Okay.
uncontrolled. So diabetes
Right.
should be under control. Hygiene has to be kept well under control. That's very, very important for them.
Okay. Wonderful, sir. On that beautiful note of maintaining your beautiful smile with, maintaining your blood sugar levels, we deeply appreciate your presence with us today, sir. And I'm hoping that this session will prove incredibly beneficial for the ones who are struggling with diabetes. So thank you so much for joining us today. It's really, really been a pleasure.
Thank you, Soumya. It was a pleasure talking to you. And I hope many of those who are listening to this conversation would be a kind of educated enough to
Yeah.
control their diabetes and not lose their teeth prematurely because of diabetes, and give more attention to their oral hygiene. And my last uh, word of advice would be this, that please brush twice a day,
Right.
at least once a day floss your teeth, and visit your dentist every 6 months. Thank you so
Right.
much. I really
Thank you.
appreciate it. Thank you.
Thank you, sir. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir. Thank you.
Thank you. Thank you.
Thank you, sir.